Welcome back to Harmonize Your Life Conversations on Self-Care for Women of Color podcast with your host, Dr. Toni G. Alvarado. We have had an exciting season 5 of the podcast, and we are now entering into the month of November. This is the last month of this particular podcast season. The month of November is Caregiver Awareness Month, Caregiver Support Month. It's Thanksgiving this month. We have so many things to be thankful for and so many conversations that need to be had during this season of the year. I'm glad that you're back with us this week, and we have another exciting guest who will be with us, actually a returning guest who will be with us on this week, helping us as we talk about self-care for caregivers. Yes, we're going to talk about self-care for caregivers in just a moment. Stay with us, and we'll be right back after this. All right, I have with me again Miss Jerri Danyelle Brown. She is not a stranger to the Harmonize Your Life self-care podcast, Conversations on Self-Care podcast. She has been with us in our previous settings. On last year, she came to us also in November for Caregiver Awareness Month. She is a member of the Harmonize Your Life Women's Self-Care Network. She is my sister and friend. She is the sub-captain of the East Atlanta Double Dutch Club here in Atlanta. Y'all seen me and my videos of us jumping rope, and we got connected actually through the Double Dutch Club, and deep calling unto deep, and there's something in me that connected to something in her, and we've been connected ever since. I consider her a sister beloved and a friend, and I'm always delighted to have conversations with her offline and on the podcast. Will you all help me welcome back to our podcast conversation, Miss Jerri Danyelle Brown. Welcome back, Jerri. You're muted. Let's unmute. There you go.
Oh, wow. And there we go with the technology. Thank you. Thank you again for the invite. I appreciate it.
No, thank you. I appreciate you as well. I'm so glad to have you here with us in this conversation that we're having. This is National Caregiver Month. And last year you were with us during this same month, and you enlightened us on some very important things about caregivers. And so I thought it would be most befitting to bring you back this year, and let's continue the conversation around caregiving. We've had a whole year of caregiving in the pandemic.
Yes.
Yeah. And it's stretched us as caregivers. You're caregiving with your father, and at the time that we were sharing on last year, I was still in a caregiver mode with my mother.
Yes.
Who has since gone home to be with the Lord. But so we both know what it's like to be caregivers, and you share so many wonderful things with us. Jerri, I know that last year you shared a little bit of your caregiver journey with us, but there may be those who have not heard your story, who are just tuning into the podcast this year with us. So can you just back up a little bit and share a little bit of your caregiver journey with us?
Yeah, sure. So I am right now a full-time caregiver to my father. And this started in 2017, that his health started to decline. First, he had a diagnosis of dementia, which led to having to find a personal care home where his medications could be managed. And then within a year's time of getting him in a personal care home, he had a mild seizure. So he had been seizure prone since a clamped aneurysm when I was in my early 20s, when I was in college. And so over my adult years, I knew that he was on some type of seizure med. But I'm assuming we really don't know what caused the mall seizure in 2018, but it really took a toll on his health. And he was recovering well. He was in the hospital, hospitalized about 2 weeks. He was recovering well, and when he went to rehab, the rehab facility, we had a setback where his medications had been misadministered, and there was seizures started again. And it seemed like every time there was an episode of seizures, his health would decline even the more. And so very quickly, from April of 2018, by September of 2018, my father went from walking and talking to being brought to my home, nonverbal, immobile, connected to a feeding machine, having to have wound care, and just 9 different meds. And they were consulting me about palliative care and hospice care. So it was a huge
and you
change.
said, and that was from April to
September of the same year.
So what? That was not even a good 6 months.
No, ma'am. No,
Wow.
ma'am. And
So
it was and I was I know I have connected to a lot of different caregiver groups in this past 4 years, and I have, it's hard for me to discuss healthcare facilities because I watched my father's health decline in healthcare facilities and at the hands of rehab facility staff, skilled nursing facility staff, memory care facility staff. And so for me, my experience was very different than what some other caregivers may feel. Putting them in a facility is a relief. It was not my experience in 2018. And so what I can say now is that my father has recovered. I do feel like in-home caregiving has made a huge difference in his condition. He's now down to 4 meds out of the 9. Where they thought he would never sit up or bear his weight, he's able to do that. We were able to get the peg tube removed and get him off the feeding machine. He's now swallowing again. And so, when you think about trained medical professionals, they're going to go by the book. They're going to go by the practices that they've learned. And I think when it comes to family caregivers, we have an inside unction that allows us to kind of move based on what we know about our loved one and what we know their potential is. And so I'm sure I pushed my father farther than any healthcare staff would have pushed him, but only to what I knew he could do.
Okay. Wow. So, when you were talking, it just kind of reminded my mind quickly went back to the time that we were caring for my mom, and particularly the last 90 days of her care. When she was in the hospital, we had the choice of putting her in hospice in a facility, a hospice facility, or bring her home with hospice, with the assistance of hospice care.
Okay.
We chose to bring her home, and that was her choice too. She wanted to come home.
Yeah.
And so we did that, and my sisters and I worked together. And we did have a good support system from the hospice team. Southern Grace Hospice is who we used, and they were wonderful in assisting us. But I know that, when my mom came home on hospice, they really didn't expect her, and we were actually told that she probably would be gone within a week.
Yes.
Like 7 days. And my mom lived a good 90 days at home with us caring for her. And I know for a fact that had we put her in a hospice facility, she wouldn't have lasted the time that she did last.
Yes.
I think she would have expired sooner, much sooner.
Yes.
But having us there, my sisters and I, and my aunts were coming in and out, and other family members were helping and assisting us. And I know that that extended her days
Yes.
and made her days more enjoyable. You know, the days that she did have left made them more pleasant. Not that it didn't have any, you know, we had issues. We did the pt.2, all that stuff, you know. Gosh, when you talk about all that, it's like my mind just went all the way back, the trouble with all of that. But yeah, so when you talked about how quickly your father declined, you know, one of the things that happens with our loved ones, particularly our elderly, our parents, it's the rapid decline. We, you know, we're in my mother-in-law is now living with my brother-in-law and my sister-in-law in Ohio, and we go back and forth there. And even this summer, we had a time where she came here in our home and we cared for her. But every time we see her, we could see such decline, and to see them go from being such vibrant, lively, you know, the parents that we knew, and then to see them decline, you know, how did you handle the decline of your father, the rapid decline?
You know, so here's the thing. For me, it wasn't as drastic of a change because I was there every day.
Okay.
So where I was able to you know, kind of be in the moment and kind of respond to these different moments of change. It was really different when a family member who hadn't seen him in maybe a month or two, you know, would chime in or visit, and you know, like their whole demeanor would change because he looked so different. You know, he was responding differently, and so for me, it wasn't as much of a shock. I think I found myself more in, just as a woman of faith, I found myself in more of, you know, I guess like fighting the doctor's report, like when they would come in and say, this is all we can do, this is his base. I would just get very indignant, you know, in my spirit, like, no, this is not his base, you know. So I found myself kind of encouraging him when the doctors would leave out, like, Daddy, I know you still there. I know you hear me, and I know you heard him, and we getting out of here. So it was a lot of those type of conversations when all the staff would leave out of the hospital rooms. Just very determined not to let that be the end. And so I feel like I know, as his daughter, knowing who he was when he was vibrant, that he's a fighter. He's a fighter. You know, we've said over the years that he is like the cat with 9 lives. You know, he is, you know, he has definitely had some hard hits, and he gets back up. So yeah, it was definitely one of those things where, you know, the moments where I really did have to accept, now this is different and I don't see the change. It was moments of grief. You know, I've shed many tears at his bedside just in the moment. And so it's just never been drastic for me because I've been in it every day.
Okay. So let me ask you this. Have you experienced any frustrations as a caregiver?
Oh, of course. Of course.
And what are some of the common frustrations that caregivers experience?
So, caregivers with siblings is often a conversation I get into. So I have 3 siblings. And when I am out with my dad or taking him to a doctor's appointment or even talking about the experiences, I'll often be asked, are you an only child? And I always have to kind of pause and swallow, like, no, I'm not. No, I'm not. So that is probably definitely a place of frustration for me, because I know I would love to have my siblings engage more. And I don't know what to say. You know, like I definitely have my moments. I always say, you know, God knows me best, and he'll let me throw my tantrum. He'll let me have my moment. And then he'll remind me, but I entrusted you with this assignment. And
Okay.
so I often have to kind of take my breath and, be like, okay. And so here I go, and move on. But I give myself, I acknowledge the moments, I
Okay.
allow myself
Frustrating moments.
to process my emotions, to throw my tantrum. Let me throw my tantrum. I'll be okay when it's over, but let me get it out of my system.
So one of the frustrations I hear you saying can be the relationship or the negotiation of caregiving and with siblings, with other
Yeah.
siblings.
And
Mhm.
with siblings that and I'll say this, with siblings that are not active, and then they may not be active because they don't know how to assist,
Mhm.
especially if they are long distance. I do have two siblings who are in another state,
Okay.
and then I have a sibling who's here local, maybe about 15 or 20 minutes away. And so, I've had conversations with other family members as far as, they will, I hear this a lot in my family. Well, they might just think you got it taken care of.
Okay. Okay.
And we've talked about the whole superwoman thing. Like,
Yeah.
if
Yeah.
superwoman needs a break,
Yeah.
okay?
Yeah.
Um,
Yeah.
she didn't ask to be superwoman.
Do you ever share when you need a break?
um, I have put myself out there. It did not go well. And so I have not done that again. I have learned to embrace the support system as they define themselves. And
Okay.
that has not been my siblings, not in the sense of relieving me physically. Um,
Okay.
so for those who have stepped up and offered to relieve me, or shared resources for respite and things like that, is where I take advantage of those resources.
Okay. So you take.
And you see, I'm still trying to be very safe and gracious with my words, because blood is blood. I love my family, and at the end of the day, I can't explain. I can't explain why the dynamic is what it is, and why people observe this situation and feel like they need to ask me, am I only child? Like, that
Okay.
alone speaks to the inactivity of my
Okay.
siblings. So
Okay. Okay.
yeah.
So what I hear you saying is, though, you're taking when you do have those frustrating moments, and you're taking the help where you can get the help,
Yes, most definitely.
and
And then
that's really
and
important.
then I have become resourceful myself.
Okay.
So, as a mother of six children, I've always been resourceful. I've had to be resourceful
Oh
over the
yes,
years.
you got six children. You know how to be resourceful.
Yes. So every time I'm somewhere, as even with me connecting to caregiver support groups, as other caregivers share, if I hear something that sounds like, oh, wait, did you say respite? What was that number again? So I'm constantly sourcing and making sure that, I build up my inventory, so that I do have that cushion and that outlet when I need it.
Okay. 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 So can you share some of your self-care tips, some of the things that you do for self-care? How
You
do
know,
you bring harmony between your self-care and your role as a caregiver?
Yes. So I am very holistic in my living. So on a daily basis, I practice aromatherapy, as far as with burning oils, burning incense, burning sage, music therapy. So there, I play certain music for my dad. I play certain music for myself, to come down, or to, shift the atmosphere. And then I do a lot of walking. I do a lot of walking, 5 to 7 miles. Sometimes I start walking and I don't even realize how long I've walked. And my walking app will say, you just hit 3 miles, and I'm thinking, oh, I need to turn around, because the farther I walk out, I got to walk that same distance back.
That's right. That's right.
So walking is very therapeutic for me. And double dutch. Ironically, I was doing my vision board in 2020 of January, and cutting pages out of a magazine, old magazine, as a matter of fact, and I saw ladies jumping double dutch, and I was like, oh wow, that would be and I'm sitting here cutting the picture, like, gonna put that in my self-care wellness space on my vision board, just as a suggestion. I'll
Okay.
buy some ropes. I was not thinking in my head to jump double dutch with others. I was just, insinuating, like, okay, yes, that's a health and wellness type thing. And as
Okay.
I'm cutting the picture, I see the caption that says women 40 and over. So I start reading. I totally got paused on the whole vision board project, and I start reading the article, and I saw the website. I go to the website, and I'm just like, oh my gosh, this is in Atlanta. And so literally that vision manifested before I could even get it affixed to my vision board.
Wow, wow,
Yeah,
wow,
yeah,
wow, wow.
yeah,
Yeah, and I attest to that. I mean, being a part of the Double Dutch Club and just my whole approach to life, holistic living, all of it. I love aromatherapy. I just believe we should live life holistically, spirit, soul, body, relationships,
yeah,
finances, the whole thing.
yeah,
And it does help us in those moments where we're giving out, because caregiving is about caring for someone else. And we do that. That's part of who we are.
yeah,
It's like you said, this is your assignment,
yeah,
right?
yeah.
But at the same time, we can't care give or give out to the degree that it depletes us. We have
Yes,
to have places. I always say you cannot pour from an empty cup. You
yes, yeah,
must take care of yourself first. And so, hearing some of your strategies for self-care, I'm sure is helpful to the caregivers that are listening. And we never know when we're going to find ourselves in a caregiving mode.
exactly. And we owe it to ourselves to nurture ourselves daily, because caregiving is daily. So it's not so much for me, it's not so much trying to find a
Good.
weekend to get away. I need to nurture myself and my wellness daily
Daily.
so that I can
Say that
be
again.
better for
You
him.
said you said I have to care for myself daily because caregiving is daily. That's
Yes.
good.
Yeah. Yeah.
That's good.
Because what I realize, and what we have to be honest and transparent about as caregivers, is we know there are times where we have opened a bill, where we've gotten off a frustrating phone call, and now we're going into our loved one and we're handling them differently, because we have
Mm,
things on our mind. And so what I have acknowledged and received revelation
that's
on
good.
is when I step to his bedroom, I need to purge. I need to let go. I need to remove whatever is happening, because what I give to him, whatever I transfer to him, needs to be in the name of healing, needs to be
Oh,
in the name of love, needs to be in the name of, encouraging and stimulating him, to live. I don't need to transfer frustration. I don't need to transfer bitterness or that last frustrating phone call I just had. So I've come
wow.
to just be very aware. And my father, even though he's nonverbal, he's very expressive in his facial expression. And that
Okay.
that is what has caught me a couple of times. Even I've come in his room to check on him, and I'm, my Bluetooth is in my ear, and I'm finishing a phone call, and he'll look at me and, like, perplexed, like, who got you so upset? Like, I can
Mhm.
almost hear his voice, and
Mhm.
so
Mhm.
I've just learned to really try to check myself at the door.
Wow, check yourself at the door.
Yeah.
Have you ever dealt with self-care guilt? A lot of times as caregivers, we feel guilty when we take care of ourselves.
Hmm.
And self-care guilt is a real thing. It
Yes.
is. I've talked to caregivers who don't know how to take a break. When I ask them, well, do you take breaks? No, I don't take breaks. I don't do anything for me. Because they feel like if they do, that maybe they're not on their job, or, they feel guilty about taking care of themselves.
Hmm.
So have you ever experienced self-care guilt? And if so, how have you dealt with it?
I have. I have. I have actually been away, stepped away for a weekend, and have actually found myself shedding tears, feeling like he's whoever I left him in the hands of is not, because I have cameras in his room, I can check on him when I'm gone. And I'm, looking through the cameras and saying that's not how I would do it. And he's probably not as comfortable as he would be if I was there. And so even in that, I have shamed myself like, I should have picked someone else. I should have, I should have waited, that type thing. And again, as a woman of faith, God will stop me and say, I got him. I got him. It doesn't matter the vessel or the hands. I got him. He is sustained. God. In your absence, he is sustained because he's mine. So, God.
Let yourself off the hook, right? Because our loved ones, just like us, our loved ones belong to God.
Yep.
And we are not God, right?
Exactly. Yeah.
We cannot be omnipresent.
Right.
We cannot do everything. We are not all knowing and all powerful.
Yeah.
So, yeah, I love that. So it sounds
and how audacious is it for me to even mouth the words that he's not good unless I'm doing it? Who am I?
Ooh, that's good.
If God selected me in that moment, he can use somebody else too.
Wow. That is so freeing.
And if I believe the testimony that I share that God is healing my father, then I have to stay in that. Even when I'm away, God is healing my father.
God is healing my father, not me.
Right.
Yeah. Yeah.
Now I understand that there is a piece of recovery and healing that my father has experienced, and I have aided in it. God has used me to assist, but it has not been in my power.
Oh my God, this is so good.
It behooves us to watch our words.
Oh my Lord. Girl, you are helping us today. And, and that will even free those of us who have been caregivers to a loved one who's passed away.
Yep. Yeah.
Because sometimes
we start questioning, what could I have done differently?
Did I do everything that I could have done? Was I there enough? Were they comfortable? Because those thoughts come. I've had those thoughts.
Yeah.
Was I there enough? Did I spend enough time with mom? Did I tell her, did I make her as comfortable as I could have made her? I believe I did, but those thoughts do come.
Exactly. Yep. And even in my travels, when I have stepped away, that has been a reminder. Like, okay, if your dad could speak and you said, Daddy, I want to step away for a weekend, would he have said, no, I need you to stay here? No, he would have said, go on, girl, get on out of here. So so even in that, like, release yourself. Release yourself. If your loved one could release you, they would. They would. They want us to live. They don't want us to feel burdened or stuck or any of that. And so even if, when you think about, because even for me on a daily basis, because of the level of care that my father needs, his day doesn't start until I step into the room, as far as feeding, giving his medicine, getting him dressed and all of that. And so even in the mornings where I'm tired and, my schedule is off, like I can't move yet. I just can't move yet. And even in those moments, it's like, but if I don't move, he don't move. Mm-hmm. And there's times where I feel guilty even to lay another 30 minutes in bed. And in those times, God will remind me. And I'll hear my dad's voice. Go on and get some rest. You ain't helping me coming in here tired.
Like, he probably want to stay in the bed a few minutes longer anyway.
Right. And that has happened too, that I've given myself another 30 minutes, and then I go into his room. He's still asleep anyway. He wasn't thinking about me.
And that reminds me of when my children were small, right? And because raising children is a form of caregiving.
It is.
And when you got small children, and a lot of times as mothers, new mothers, we wearing ourselves out trying to make sure we do everything at a certain time. And one of the things one of my friends said to me when my children were small, she was like, "Honey, those kids want to be away from you just as much as you. You need to take your break." Because I would feel guilty when I would leave my children, or if I had to go out of town for ministry or something, I would be crying. And my friend said to me, "They want a break from you, just like you need a break from them.
Right.
They need a break from you."
Yeah.
You know what I'm saying?
Mm-hmm.
So we do in so many settings, whether it's a sick loved one or whether it's caring for children, a sick child or well children. It doesn't matter. We all need breaks.
Yes. Yes.
We all need breaks.
And I have even noticed, you know, now here it is. I'm in his room daily. I'm saying good morning. I'm playing music to try to give him the bob his head and everything. And let a visitor come. They might get a smile from him. He might lift his hand. Oh, and I'm just like, well, goodness, you didn't give me all of that. so it is, and you know, there's times where I'm thinking about clutch my pearls. Well, how am I supposed to feel?
Girl, oh Lord have mercy. I hear you. I hear you.
So I tell him, I said, you hurting my feelings. Well, can I get a smile like that?
Let's talk about that, because sometimes caring for our loved ones, I recently a caregiver said to me that, you know, they were caring for a loved one, and their loved one, and we experienced it with my mom, and even with my mother-in-law. When they're ill, sometimes it changes their disposition.
Yes,
it changes their attitude, and they will lash out at those that are closest to them.
Yeah.
Right. Yes. Let's talk about that. Because that happens. And how do we deal with that without getting angry with them? You know what I'm saying? And meeting that emotion with our own anger or frustration or disappointment, because we're the closest one to them and we're caring for them. That, you know, they may need they need a space to be angry too.
Exactly.
They're not happy about being in the position they're in.
Right. Yep.
But they'll take that out on us as caregivers. Has that happened with your father? I hear you saying.
Yes. So, and so for me, it's been a little different for any caregiver whose loved one is verbal, because my father is not verbal. So I haven't I've heard the stories of caregivers getting cursed, and you know they're hearing their loved ones say things that they never thought they would say, and you know, just very harsh statements. And so I don't have that because my father is nonverbal. However, he has his way of shutting down, is what I call it, where he just will not assist with, you know, he won't, you know, he'll get stubborn about wanting to open his mouth or lift his arm or anything. Mm-hmm. And so what I have,
and he's probably cursing you in his mind.
that part. Exactly. And so what I have come to do is step away. You know, just like so I very often put myself in his shoes. If I was once a very independent man, you know, not needing anyone's help, and now I can't do anything without the assistance of someone, I would have my moments of frustration too. Yeah. So when he shuts down, I'll leave him where he is, and I'll step away, and then I'll come back. You know, either, you know, he may fall asleep, or he may start, you know, listening to the music, or, you know, he'll catch something on the TV or whatever. I just give him a moment to shift.
Yeah. Yeah. When we were having this conversation in our tea time, and Dr. Claudette Copeland was on, and one of the caregivers that was on, she was sharing about her loved one, and talking about how her loved one was angry and lashing out. And she said, Dr. Copeland said something. She said, you know, they need a place where they can tell the truth, where when our sick loved ones, where they can, you know, be revealing about how they really feel. And sometimes they can't do that with us. And so, so when you're at the bedside of a loved one, it's a very, very, it can be a very tenuous moment. It can be a very tenuous thing. And we do need those skills and a place where our loved ones can get the help they need, mental and emotional health, not just physical health, but a place where they can talk. I know when my mom was going through, she had bouts of depression,
Mm-hmm.
and in the hospice facility that was serving us, they had, counselors that would come and talk. And there were times I would say, Mom, talk to the counselor, because there are things that she needed to process about her life and her disappointment, her anger, her fears that she couldn't share with us.
Right.
And so she needed a place to share those things. And then we needed a place to share those things as well. And so I highly recommend caregivers have therapy, have a place of support, a place where they can share, and a place where their loved ones can share.
Mm-hmm.
So talk to us about how important it is for caregivers to have that support system and communities where they can.
It has made a huge difference for me. I noticed early on. So again, my father, there was about a year where he was in a personal care home, still pretty independent. And the personal care home was really just administering his medications and making sure he had 3 meals a day. But he had, full reign to do whatever he wanted with his day. And so in that year, it was, it wasn't as much pull from me as far as checking on him. And, but I did notice that even the things that were happening and how my life was adjusting to just start managing his affairs, it wasn't the normal conversation because my immediate circle weren't in that season of life. And so I very quickly realized that I needed to find a group that could speak the same language, that were in the same season of life. And so, ironically, I had already connected with a few caregiver groups before his health declined. And so even as his health was declining in 2018, I was, at his bedside, but able to send a post so the doctor just said this, and still get that support virtually until I was able to find a group that actually met in person. So it is very, very important. And I think, again, when you talk about mothers and young children, it's the same thing. When we think about finding mommy groups and doing play dates and all that type of stuff, it's the same thing. You want to find people who are speaking the same language, people that are in the same season of life. And so caregiving is the same way.
Yeah, it's the same way. So can you recommend some caregiver groups to those who are listening?
Oh, wow. There's several of them. Some of them bigger, larger ones, Caregiver Nation, Caregiver Hub are two big groups on Facebook. And then because I'm a daughter specifically, in my search for caregiver groups, I found one that was called the Daughterhood Circle. And so this is all women who are taking care, either a father and a mother or both parents. And so that one has been it's just been amazing. I have stepped into leadership with Daughterhood Circle and have done some podcasts and discussions with them as well, because it's a different conversation. And then even to, narrow it down from there, daughters who are specifically taking care of fathers is a different conversation, because now you are handling your father's body in a way that you just did not think you ever would have to, and so it's a paradigm shift to really step outside yourself. You can't be daddy's little girl and change him at the same time, and so it does take you to a different place.
Okay. That's very, very good. That is very, very good. Jerri, you're always such a good dialogue partner, and a wonderful wealth of resources. And I love you and appreciate you. Can you give just one final word of hope or encouragement to someone, a daughter or a wife, a mother? Some of the women that are listening are wives caring for a husband. Some are daughters caring for a parent or a an in-law, which that has a different dynamic too.
Yeah.
or we're caring for children, or maybe a sick child, or we're just a caregiver of healthy children,
Yeah.
and just, in that season of life,
Hmm.
but maybe dealing with frustrations
Yeah.
around
Hmm.
caregiver. It's National Caregiver Month. And so I would like for you to pray for caregivers as we close out. And before that, if you have one last just kind of word of hope
Hmm.
for caregivers, and
Yeah.
then I'd like for you to end with a prayer for caregivers.
Yeah. Most definitely. Thank you. So if I could say one thing, it would be to embrace your season that you're currently in. And when I say embrace your season, do an assessment. What you did in the past season may not be what you have capacity to do in this season. So embrace the current season and check your capacity, check your plate. What needs to come off your plate so that you do have capacity to fully give, what you need to give for the sake of caregiving. Make sure that you take care of yourself. Understand that in the midst of you caregiving for a loved one, that it is a blessing to yourself, to your wellness, emotionally, mentally, spiritually, physically, to be at your best, to be able to take care of your loved one. And so give yourself some grace. That is always a reminder. Understand that you don't have to be superwoman, you don't have to be superman. What you have to give is enough. Your loved one does appreciate you, regardless of what comes out of their mouth. Your loved one does appreciate you. God loves your heart and what you're giving. And just give yourself some grace. Give yourself some grace and remind yourself that what I'm doing is enough. What I'm doing is because God has entrusted me with this assignment. Remind yourself that a burden is a blessing in disguise, because
Mhm.
what you're able to experience with your loved one, no one else will. In those moments where you see the glimpse of joy in their eyes because you made them laugh or made them smile, no one else gets that memory but you. So embrace the beautiful moments, and continue to nurture yourself, and understand being self full is not being selfish.
I love that. Being self-full is not being selfish. We have been blessed today by Jerri Danyelle Brown. I do want to share with you all where you can find her on Facebook at Jerri Danyelle. You can find her on Instagram at the Jerri B. Look up that daughterhood circle if you are a daughter caring for a father, a mother, a grandmother, or maybe a mother-in-law or father-in-law. Look up that daughterhood circle, or look up some of the other caregiver circles that Jerri mentioned to us. Thank you again for joining the Harmonize Your Life Conversations on Self-Care podcast. You can follow this podcast on Apple, on Google, on Spotify, on the lightatl.live internet radio. If you have not subscribed to my YouTube channel, please go to my YouTube channel at Dr. Toni G. Alvarado. Like and subscribe. It doesn't cost you anything to do that. When you do that, it'll cause the algorithms on YouTube for this type of conversations to come up more readily in the search engines. The more people like and subscribe our YouTube channel, then this type of content that is helping people will be more readily available. So please go and do that and be a part of what we're doing here in these conversations. Ladies, you can join the Harmonize Your Life Women's Self-Care Network. You can do that on my website at drtonyalvarado.com. I want you to join the Self-Care Network, because then you can be a part of the things that we're doing in the network to help you. If you are a caregiver, this will be a wonderful group for you to be a part of, the Harmonize Your Life Women's Self-Care Network. And that is available on my website at drtonyalvarado.com. Go there and look us up and join us. Jerri, would you close us out today with a prayer for caregivers?
Sure, sure.
Thank you.
Lord God, we thank you. We thank you and we give you praise for just allowing us to be your chosen vessels to administer and give healing through our hands, and love through our hands. And we thank you, Lord, for giving us hearts of empathy. God, we give you praise for just guiding us in what we do on a daily basis for our loved ones. We thank you, Lord, for healing and recovery happening in our loved ones' bodies because of the things that you lead us to do on a daily basis. And God, help us to remember ourselves. Help us, God, to take care of ourselves as it pertains to wellness, as it pertains to our mental health, our emotional health, our spiritual health, God, that we would take pause in our day to give gratitude, to speak gratitude and affirmations over ourselves, understanding, Lord, that you have given us grace and mercy and favor for such a time as this. God, we thank you that as we are honoring our loved ones, as we are honoring our fathers and mothers, God, that our days would be prolonged.
Yes,
God, we thank you
yes.
for reminding us, Lord, that as we do for your children, because they are your children, as we do for your children, so shall you do for us, and so shall others pour into us, God. So we thank you for resources coming from the north, south, east, and the west. We thank you, Lord, for sending respite and relief when we don't even expect it. And God, we give you praise for just pouring love onto us that we would have more to give to our loved ones. So thank you for refueling us when we need it, even when we don't know we need it. Thank you for refueling us. Thank you for just allowing us to find joy in each day, to find a reason to smile, a reason to be thankful for the assignment that's been placed on our lives as caregivers, God. We give you praise. We give you honor for this season that we're in. And may your name be glorified in all that we do. Amen.
Amen. Thank you again, sis. I appreciate you always, always. Thank you all for joining us this week, and we hope that you'll stay with us all month through the month of November as we close out season 5 of the Harmonize Your Life Conversations on Self-Care podcast with your host, Dr. Toni G. Alvarado. See you next week. Hi, this is Dr. Toni Alvarado, and I want to personally invite you to join the Harmonize Your Life Women's Self-Care Network. Join us for fitness motivation, health and wellness information, inspiration, self-care strategies, and ideas for creating harmony in your life. As a certified health and wellness coach, it is one of my greatest honors to support women in their fitness, health, wellness, and self-care goals. Join the Harmonize Your Life Women's Self-Care Network, and we will do you good on your journey.